Welcome to episode 2 of the Tap Talk podcast. Today we have a very special guest, Dr. Alex Shuchuk of Regain Your Gain PT. He's located inside with us here at Total Athlete Performance. So, Dr. Shui, go ahead and introduce yourself. Tell us a little bit about RYG.
Yeah, absolutely. So again, my name is Alex Shuchuk. I am a licensed sports physical therapist. Kind of my background, went to University of Wisconsin both for undergrad and for my DPT. Pretty shortly after graduation, went out and started my own little practice that's now known as Regain Your Gain. It's kind of been a fun journey getting to where I am now with Zach and the Total Athlete Performance guys.
Yeah, it's been incredible for us as well. How long has it been now?
What are we on now, like year 4.5?
Yeah, so it's 2022?
2022, yeah.
Okay, yeah.
It's gone quick.
Yeah, it feels like yesterday. That's crazy.
Yeah.
So talk about those, I guess, bring us back to when you graduated from physical therapy school. Kind of why go into this space of starting your own practice? Yeah,
so I kind of knew early on that I kind of wanted to have my own freedom to be able to practice how I wanted, not be handcuffed by, let's say, like insurance and kind of the confines of being in a larger hospital system. So initially went out, had a mobile treatment table that I threw in the trunk of my car and was seeing patients, athletes, parents, anybody I could scrounge up through word of mouth and seeing them in their home gyms and their basements. Did that for a few months, worked out well, and then bumped into you guys and the rest has been history.
Yeah, I remember that first day you came in, Zach was like, we got this PT coming in. I was just like, we during that time, we were at a very difficult, it was a difficult time of our business. There was a lot of stuff going on. It's like, oh, here we go again. Because before we've had multiple PTs come in, typically, more established practices that would want to set up shop inside our gym. So I was like, oh, okay, we'll give this guy, we'll give him a chance. And I mean, within probably the first 20 minutes of meeting you, I was like, okay, this seems like it would be a good fit. Mainly because you were our age, you have a hockey background, we're hockey people, and it was just kind of like you were starting from scratch. I was like, and we were still young as a business, and it's like, okay, the vision of us growing together just made a ton of sense.
Yeah. Well, and you didn't even talk about how you gave me a tryout.
Oh, that's right. Yeah.
So Zach here was dealing with some, what was that, like some posterior knee pain that had been bugging you for a while, especially sprinting?
It was knee pain, and I could barely move at speed camp.
Yeah.
And I was just like, oh, this would be perfect. Let's see what this guy's got.
Yeah. So he made me assess him, took a look, we figured it out. It was kind of a funky case too. It was like proximal gastroc strain.
Yep.
Rehabbed him back and kind of built up that trust that maybe I do know somewhat what I'm talking about.
I just thought it was jumper's knee, so I was just loading the patella tendon and thinking that was gonna do it, and never worked. And yeah, you kind of diagnosed me within 30 minutes and gave me some exercises that I rolled with for 2 or 3 weeks, and it's gone. I haven't had it since. So
let's go.
Yeah.
But yeah, it is crazy how much things have progressed and changed over these past 4 years.
Yep.
Thinking back to early on when we were working together out of essentially what was like a utility closet inside an ice rink.
Yep.
We had no AC, no heat, tiny space heater that didn't do shit.
Yep. It went up to 32 degrees.
Yeah. Well, I remember seeing one of my baseball athletes, okay, and this was in February, and he just wanted some soft tissue work done on his elbow, okay? And in order for me to actually even crack the seam on that cocoa butter, I had to warm it up in my car next to crank the heat in my car to get it to kind of melt down and liquefy a little bit so I could go in there and actually do some soft tissue work. Because it was so cold in that ice rink and utility closet that it would freeze up and be rock solid.
It was. I mean, there were days when we would have 6 a.m. morning sessions, and I would text the group that was coming the night before, and I would say, you need to bring gloves.
Yeah.
Because we can't touch metal plates without having something in your hands. I mean, it was brutal.
Yeah.
But
I have a picture on my phone, and we'll overlay it to right now, the temperature reading mid-session saying it was a whopping 32 degrees in that
on
room.
The space heater. Yeah, that space heater didn't stand a chance. Yeah. Crazy.
I remember trying to like trap right and try to grab on the pull-up bars and like either wrap a towel around your hands because it fucking freeze your fingers.
Probably wasn't legal to work out in those temperatures, but we did it. We grinded through. And
what's crazy too is how much the numbers exploded even in those kind of harsh conditions, and it kind of was a testament that showed like no matter the facility and what we have actually access to, what really matters is like the coaching, the rapport, the trust that we build with our athletes, because that's what kept people coming back in. I mean, for how crappy of a space that was, I mean, especially for you, your numbers skyrocketed. Like you had that girls group that grew and grew.
Like 15 plus.
And that place was vibing in the morning, which was sweet.
On the first podcast episode, I was talking to Taylor Stremel, and I was like, I can't believe that you trained in the hockey rink. It was wild. But I'm glad, very thankful for the hockey rink, and glad because, number one, it developed a very a unique environment where, because the space was so confined, I just developed relationships with athletes, and I mean, there was no choice. There's nowhere to run and hide. It's you were communicating, talking to athletes every single day, and also forced me to be creative with my programming. I totally changed my style of programming because I didn't have access to like a Shremmel or these ohms or a 1080 with that space. I was like, how do I get speed results in a closet?
100%.
So I turned to trainers like Chris Corfus and got creative, and we started getting really good results still. And it was like, well, imagine if we had a good facility. So now we're here. Which is great.
Well, I mean, to piggyback off of that, I mean, I feel like that's where I grew the most as a physical therapist.
Same.
I mean, we had nothing in there. And so just working with the minimal pieces of equipment in space, just like you said, forced me to get creative and err more on the side of the education and communication piece, which is a much larger piece of the puzzle when it comes to these sports rehab than people realize. Like, the therapeutic exercise, the hands-on work, it's all important, but providing the education to the athletes and parents is just as important, if not more. And really leaned into that, honed in that skill because I was forced to in that environment.
And that's the other big draw that Zach and I had towards you. It wasn't, okay, I'm a PT, I have all these fancy tools and I'm just going to use these tools. It's, I mean, you're a performance coach. You have your CSCS. You're using the weight room and exercises and getting kids stronger as a form of PT. So I think that's what meshed so well early on. Yeah,
and I feel like that works so well with kind of our partnered business models here is, we kind of come from similar backgrounds, and so everything just kind of blends really well when we're providing advice and recommendations to our athletes. Like, we're not siloing each other off. And it works well.
I mean, and fast forward to now, so now we obviously have a gym here in Verona and also in Windsor, and you're going through both. So you're stationed at both. Talk about that, because it's right now it's still a one-man show. So you're going 2 gyms. How are you managing all that?
Yeah, I mean, it's a lot, but I mean, for anybody that has their own small business, it's always a lot. You kind of know that's what it's going to be going into it. I think one of the benefits of bouncing between 2 locations is you kind of get to grab all the best bits and pieces from each spot. Like, you and your crew over here, I wouldn't say it's not drastically different, but there's little nuanced pieces that are a little bit different than what the other pod of coaches are doing out in Windsor. And you both have things that you're really good at. And I'm able to be in both those environments and pick up all those best pieces and kind of implement them into the things that I'm doing day to day, which is nice.
Makes a ton of sense. So, I mean, let's get in the nitty gritty now. Let's talk about some injury type stuff. So from being a part of your journey and seeing you now, so you're getting a ton of ACL clients. How did that start? Are you seeing more now than you did early on? Like, talk me through that.
So that's everything I've done has been just very organic, word of mouth. Like, I really haven't done a marketing push. And I mean, I'm at the point now where 2/3 of my athlete patient base are ACL reconstructions, which is kind of insane and not anything I kind of planned or expected. I got my first ACL early on. We had really good outcomes. Word spread from him and his parents, and just like that, it was wildfire. Like, hey, go see RYG and TAP for your ACL. Yeah, so it grew just by having one ACL athlete to now I'll see anywhere from like 6 to 8 a day, which is unfortunate that they're happening as much as you are, but it is what it is. I'm glad they're getting in front of us and we're able to help them back to playing their sports, because it is a complex process. Like every ACL is a little bit different. I love working with them. They're one of my favorite patient cases because exactly that. Each one is unique. It's not stagnant. It's fun for me too because you're stuck around with those athletes for 9+ months, so you really get to know them and their families, build that rapport. You kind of see them really grow, not only as an athlete but as a person over those 9 months. Like ACL rehabs suck. They're mentally draining. So if you can get through the other side, I mean, there's a ton of growth that comes from the mental and physical side, and it's cool to see that happen.
And I think the piece from a mental standpoint, it's very hard. The nice thing that we have going on is that we kind of combo training with a lot of the ACL patients that you see, whereas they're still doing a form of performance training with us. They still have 3 good limbs that they can train safely and smartly, right? But it's not like they're just getting PT and going home and having to think about it, right? We're keeping them busy as well with upper body work, good limb work. You know, I think that goes a long way in keeping these kids mentally in it.
Yeah, I love what we've kind of fostered here, which I think is really unique in the private practice setting. Like, we're very much following more of a pro or college sports model where the performance staff and PTs are all together collaborating. It's very interdisciplinary. I mean, what we're doing here is essentially ACL. It's any surgical case or any athlete in general that's hurt, but if we're talking specifically ACLs, they'll come and see me for that knee rehab. But then they got you guys right here, and I strongly encourage, like, hey, it's important that the rest of your body doesn't get behind, because again, it's a long process. Some of them push an entire year rehabbing, so making sure good leg, core, cardio, conditioning, upper body all stays fresh, strong, moving well is so important once they kind of get to that return to sports phase later on down the road. Also, even just from like a mental standpoint, like getting in and being around other athletes that are the same age playing a similar sport, you feel like you're training and working towards something. You're not just doing knee rehab for 9 months in isolation, kind of in a stuffy clinic. It keeps them focused around other athletes, which I think is so important from the mental side of things.
And I think the other unique thing is, like, we can whether it's ACLs or other injuries too, is that bridge, right? Like, you know, it's in your name, regain your game. How are we getting these kids? We're always thinking with the end goal in mind. Okay, what will they be doing when they return to play? It's nice us being speed people, getting to see your like return to play process, specifically like return to run, or just any agility, like taking them through those steps to get there. That's been awesome. I mean, we have the shred mill, the ohms, the 1080 to really help that process. I've learned so much. So even when I see like minor stuff go on, I was like, well, Dr. Shuey, I've seen him do this, and this for like a return to play hamstring. Let's start incorporating some of that. So like all that's like, it's all, like you said, there's no silos. We're always communicating and bouncing ideas off each other, and it's such a seamless process. And I mean, I feel like you're perfectly positioned too for those little tweaks that you're pretty confident that, hey, this is what's going on. Like, you can incorporate some corrective exercises, some quote unquote like rehab into their actual training without necessarily having to refer them out, which I might get poo-pooed for saying that, but like if it is just a little hammy tweak and you know it's a hammy tweak, like absolutely throw some hammy rehab at them. Like, they don't necessarily need to go into the pipeline, go actually get like a physician referral and see their primary care just for them to come back and say, hey, you have a grade 1 hammy strain, like, do a hammy curl. I feel like we have talked more than enough on the more basic rehabs. We're absolutely more than capable of fixing people up in the moment as part of the rehab training, which I think, again, is another really cool and unique thing that you guys are doing here, which I think your athletes don't realize how blessed they are, that
for every single athlete, everything is individualized.
Yeah.
If somebody's coming in and they're having, let's say, a little bit of hammy pain, you will tweak their program and be like, hey, we're not sprinting today. Let's do some gentle hammy loading to kick off some recovery and healing through that guy. We'll modify, maybe we'll do a little bit more upper body. We'll do some conditioning that maybe isn't gonna put that hamstring at risk. And I mean, it seems like a no-brainer to you because you're doing it every single day. But that's not happening in every performance gym around the country, especially with like personal trainers. I mean, they have the program written down on a piece of paper, and the expectation is, I don't care what's going on with you, you're doing what's written down. I just don't think your athletes realize how good they have it.
Right. Yeah, I think, and now we're at a point too where if an athlete's been here a while, they know that they can communicate with us, and they kind of know we have a plan A, a plan B, a plan C and D are kind of ready to go right away. So the athletes have been great about like communicating about how they feel and about how we can tweak some stuff too. So, and yeah, it just makes a ton of sense. So let's talk about basically performance training in general. Because you like we talked about before, you use like a performance training model. What are some of your go-tos? Like, I mean, maybe this is a general philosophy question, but you have an injury, you can pick any injury. Like, where's your foundation? What are some things you really rely on and fall back on?
I mean, I think first and foremost, like, obviously the core base of our clientele are high-level athletes.
Right.
They're trying to get back to their respective sports, and you got to plan with the end game in mind of like what that sport is. So making sure once they're kind of getting to the back end of their rehab that the demands of whatever they're doing in here, whether it's with me on the rehab side of things, or if we're partnering up and they're doing some performance training with you, making sure that the demands that they're expected to do as part of their sport is being as closely matched as possible in here in the clinic and gym setting, which it's challenging to do at times. Like we are limited. Like, let's say for a soccer athlete, like we might not necessarily have the time and space to be doing a ton of running conditioning, but we can hone in on some of the bits and pieces of the demands of, let's say, soccer, like making sure, okay, we know you're gonna sprint, you're gonna change direction, you're gonna accelerate, decelerate. So let's say if it's like a knee injury or hammy, like making sure we are trying to get as closely to matching the demands of whatever it is you're gonna be doing in, let's say, soccer in here, making sure everything looks good, feels good, you're moving well, so that when they do return back to whatever sport it is, it's a nice seamless transition and they don't have to worry about flare-ups, re-injury, because they have a nice long runway of doing some of those intensities, those movements here in the gym before they kind of get set free off into their sport, if that makes sense. So I wouldn't necessarily say if there's like a core key list of like exercises and movements. It's more so the philosophy of just whatever it is that they're planning on doing, making sure we are trying to ramp them up to match whatever that sport or activity is later on down the road.
It's a lot deeper than simply doing a strength test and getting it back to even on both sides. Yeah,
and I mean, but there is value there in doing, like, let's say some like isometric quad testing. Like, we want to make sure they're not compensating through other muscle groups. We want to make sure, like, doing a knee extensor test, that like the quad is strong, because that is a very valuable piece that athletes can compensate around. But it's just one small piece of the puzzle. It's really important information, especially like when it comes to like ACL rehab. But it's part of a larger kind of return to sport testing battery. It can't just be the only piece.
And I think you brought up something too, is like, we don't have a ton of space here, but we have plenty of space, like the deceleration piece. I think if you look at the sports performance world in general, I think deceleration is massively overlooked. I think people just don't take the time to train it. And I mean, I'll shout out Aaron Malloy. He's a pro soccer player that we train remotely. I get his GPS data. He sends it to me all the time. And the amount of decelerations that are occurring in his sport of soccer are double and triple the amount of like high intensity accelerations he's hitting. So when he started saying that, I'm like, whoa, I need to be programming deceleration at certain points of the year with basically all my soccer players and really any field sport athlete that involves deceleration. And that's also where a lot of injuries occur.
I mean, I do it all the time as part of my rehab process, like that quicker eccentric load. I feel like what's fun working with you is I see all the cool variations and new things that you're trying to, work on that deceleration stimulus.
Yep.
And so I can take some of that and plug it into my rehabs, whether it's more of an isolated, just like quick drop squat or snap down, just like early phase decel stuff that honestly I do as part of like our ACL rehabs early on, so that they're starting to build that quick eccentric load early on, so that later on down the road when they're actually doing a full stop. But yeah, there's just like with anything, there's a huge spectrum to it.
Right.
I've been piggybacking off of all of the actual, like the narrow base and wide base stopping, and I think it's important, and making sure they're actually like, let's say, not to get too in the weeds here, but like actually loading into like knee and quad, and again, not using a compensatory pattern where they're sitting back in the hips for twofold. One, performance-wise, it's not ideal.
Right.
You're not getting very much leverage if you're just pushing back in your hips. But from a PT side, it just kind of shows me that you're staying away from that knee and being avoidant, which you do that hundreds, thousands of times. It's not an ideal movement pattern, can lead to other injuries.
Right.
That leg isn't getting exposed to that load over and over again, so when it does, maybe it's weak, not ready. That's where flare-ups or re-injuries happen. Yeah. So making sure, if we're talking specifically about like the decel or that quick eccentric, that they're getting in those correct positions and loading appropriately so that it translates onto the field.
Right, no, it makes a ton of sense.
And building the volumes, like you said with Aaron, how, far more higher intensity decels than XLs, like making sure we're building a decent volume base in here so that they have a fair amount under their belt before they get back to whatever it is they're doing.
And that just goes back into like, an individualized performance program. I think the space in general is the sports performance space, or the S&C space, whatever you want to call it. It's people love to live in a concentric world where let's move weight, it's all concentric, everything's vertical, and they miss the whole other piece about fast eccentrics, braking, decelerating, that really is way more specific to your sport, to be completely honest. So blending that in the performance setting too, I think is huge from a, let's call it an injury reduction standpoint, but it just prepares you for the game a little bit more efficiently.
Yeah, and it's not pretty. Like I know like kids like to move weight around concentrically. They like to pull a trap bar up as heavy as they can.
Which is important too.
It is important.
But like, it's all about, we'll go back to that puzzle talk. It is one piece of the puzzle, and there's many pieces to the puzzle.
Absolutely.
It's not the end all be all. Yeah, makes no sense. So let's transition a little bit. Let's talk about hockey just a little bit.
Okay.
So you played hockey at a high level. Your dad played hockey at a high level. What was it like growing up with a dad, playing the NHL? And did that lead you to want to be in the sports world as your career?
Yeah, I grew up in a very hockey family, whether it was him or both my sisters played college hockey. I was lucky to ride the bench at Wisconsin for a few years in college. So I think it's, from my perspective, I see a fair number of hockey athletes, love working with them. This, you played hockey as well. We have an awesome hockey group that comes in here and trains. Being able to speak the hockey language, it's its own vernacular. They have their own words, their own sentences, and being able to translate what they're saying and spit it right back at them is really important. It sounds dumb, but it just goes back to building that trust and rapport. Like if you know what they're talking about and you can give it right back to them, they realize very quickly, like, okay, this is a hockey guy. This guy knows what he's talking about. Like if I'm trying to get back on the ice in a timely manner, he knows hockey. He knows the demands of the sport. He knows what the game entails. And we can candidly have those conversations without me trying to guess. Like, truthfully, there are other sports that I'm not nearly as well versed in, like swimming, dancing. Like I've tried to learn as much as I can. I see a fair number of those athletes, but obviously that's not what I grew up playing, participating in. I grew up in a dancing family. Hockey is a different story, and I feel like the hockey athletes can feel that from you and I, because we know the sport, we know the game, and quite truthfully, like in the PT world, unless I'm just missing something, there's not a ton of physical therapists, at least in the United States, that have a hockey background per se.
Right.
There are a lot of hockey PTs out there and they do a fantastic job, but you look at like baseball, football, soccer, there are some really good sports physical therapists that grew up playing those sports, speak those languages, are able to identify with those athletes really well. I think hockey has a bit of a void that I'm hoping you and I can fill a little bit. Especially when it comes to like the return to sport on the ice. Like hockey has its own very unique demands that's far different than a field or court-based sport. And so making sure there's not only like a ramp up within the actual clinic and gym setting, but also on the ice, which I think is a huge missing piece within like the hockey rehab world.
Exactly, and that's why I brought up the hockey question in general is, you're doing some cool stuff. I mean, you presented, was it last summer? We went down to Vegas. You presented at that PT hockey clinic about the return to play on the ice. So having a PT actually on the ice with a hockey background, we'll call it return to skate, return to hockey, whatever it is, that's a whole different ball game than return to play for a field sport athlete. Maybe dive in a little bit on what you're doing with some of that return to play when you're on the ice with a client coming back from an injury.
Yeah, I mean, again, it's no different than our earlier conversation about working with the end game in mind of matching the demands of whatever sport it is. So in this case, hockey. So having a game plan and kind of scaling back depending on what the timeline is for when we anticipate they'll be back to practicing, playing again, and just laying out a progression. So we've been talking a lot about ACLs. I do see a good amount of the crossover of ACL and hockey players. So if we kind of stay in that vein, so kind of around the time when a field or court-based athlete would start like introducing plyometrics or jogging is kind of the same time we'd get an athlete, as long as everything looks and feels okay and they're kind of checking the objective boxes in terms of strength, stability, making sure swelling's down, we get them out on the ice. And it's not like they're out ripping it on the ice. It's very low key. They're doing some edge work, some glides, some holds. And the most important pieces early on are just making sure, one, they're building confidence and trust in that limb, but also they're like hitting good skating positions. Going back to before, like very easy for a hockey athlete to start to compensate with hips, lumbar spine, trunk, and not actually like loading forward anteriorly through that knee. So that's one thing that we really look at with our kind of early return to skate hockey athletes, is getting them into some positions and drills where we're making sure they're actually staying stable and loading into that knee. They kind of check that box. We can actually start doing some skating, some crossovers, which then transitions into some stopping, starting, some pivot turns, mohawks, things that are a little bit more demanding, challenging, requiring a bit more balance, stability, strength. They check that box. We can add a bit more chaos to the equation, so get another body out there that they need to like react to a little bit, adding some little bumps and pushes both ways, so kind of getting them mentally prepared for contact. They check that box. Maybe they start to transition a little bit into practice, whether it's just some flow drills or some warm-ups. They check that box. They're a practice participant. And then they take the non-contact penny off, full practice participant, and then they transition back into gameplay. And that's stuff that's been happening for years for like basketball, football, baseball, and it happens in hockey, but it's more so the PTs or sports medicine staff, at least in the private practice setting, are giving very general recommendations, which that's totally fine. It's just they don't have as much of a hockey language knowledge base, which again is, I'm hoping we're filling that void a little bit.
No, I think you are for sure. And like you mentioned it too, but I think it's very important to, I mean, you just laid it out, check a box, then move on, and not skip steps. I think that's where people can get into trouble, is they bite off a little more they can chew early on. It's about checking each box, moving on step by step until they're fully ready to play.
Yeah, and it goes back to, like, again, the mental side of things is equally as important as the physical. Like, yeah, they want to make sure we're checking the physical boxes, but at the same time, also checking in on the mental side of things. Like, if they're out there and they're just biting their lip and they're skittish and they're nervous, anxious about being out there, like, that's not a checkbox.
Right.
Like,
right.
we need them to build full confidence in what they're doing. Otherwise, when they get back to playing their sport, they're going to be thinking about that knee the entire time. They're not going to be the same player they once were, which is not ideal.
Right.
So it's so important, yeah, not to skip steps, rush the process, because the moment they have a flare-up or maybe aren't moving as well as they hoped, now thoughts start bubbling in their head, and you can't have that when
Right.
they need to be 100% go
Right.
when it gets back to game time.
When there's chaos and the sport's a million miles an hour.
That's where other injuries end up happening.
Right, exactly. That makes a ton of sense. Well, awesome. I think we summed up everything, that kind of our process here and how efficient it's been working. But I always want to touch on, where can people find you? Social media, are you active on there? Maybe give us your Instagram handle.
Yeah, getting more active on social media.
You are.
I got my 3 social media interns grinding for me right now, so stay posted. There'll be stuff coming out. But my personal, at dr.shuey, business account at ryg.pt. Yeah, give us a follow. Start posting some stuff here.
He's posting good content. Give him a follow.
Yeah.
Well, thank you, Dr. Shuey.
Thanks.
That was fun.
Yeah, do it again.
Perfect.